Okay, so we're going to talk about how to prep our patient for a surgical procedure. In the school, we're going to mainly focus on spays and neuters of dogs and cats, but there are a few others like mass removals and extractions and dentals that we can do. We're going to just focus on the spays and neuters. To get ready to prep your patient for surgery, you're going to need to make sure you have all your equipment ready. You're going to need clippers, your tray with your gauze in it. You're going to make sure that you have dilute chlorhexidine in the one side and your sterile water in the other side. You can use betadine products and you can use alcohol as your rinse, but in school we're going to stick with the sterile water and the chlorhexidine. You're going to already have that poured into the containers. Since we're practicing and showing you how to do this on stuffed animals, I'm actually not going to make the materials wet. Okay. Blocks are going to be pre-calculated up. I've just got a little water in here just to show you what to do with them. So first off, I've got my 3 patients lined up. In reality, you're going to only have 1 patient at a time in front of you, but I want to show you the different patterns that you're going to clip with. So your spay is going to be lined up in dorsal recumbency, already in position like you're going to lay them on the surgery table. You're going to clip your patient from the xiphoid process down to the pubis. You're going to go lateral to the ribs and the groin area. So you're going to clip this area right here. I know it's a little harder to tell on a stuffed animal, but you'll be able to feel it. Okay, so if you turn on your clippers, I'm going to turn back off because they're going to make too much noise. You're going to line up your clippers and you're going to shave right across your patient. All the way across. All the way across. If you need to, you can turn around and go this way, because I will tell you right now, the hair doesn't always grow in one direction. So clipping, you can clip back this way. If you've got a pregnant dog that has nipples that are a little bit more swollen, you might have to change your direction around there, pull some skin a little bit taut so you can get around areas. You're not going to hurt the patient in that aspect. So clipping from xiphoid process to pubis, lateral to the ribs and the groin area. For your dog neuter, it is going to be similar in the aspect that you're going to go lateral to the ribs and the groin area, but you're going to go to 2 inches above the penis and you're going to shave the testicles. So you're going to go around this way. You can still go this way. You're going to want to make sure you do go over, and you might have to turn just a little bit so you can get into any crevices. The testicles, you want to be gentle when you're shaving those because you don't want to razor burn those. They will itch upon recovery like you wouldn't believe, apparently. At least that's what the dogs say. Your cat neuters, you can either shave or you can pluck. So position can either be in dorsal recumbency or in lateral recumbency, which would be like this, where you can still see the testicles. So if you're going to shave, you do have to kind of hang on to them, and you can shave around. You want to make sure that you don't shave over the penis. And a lot of times when you pull the testicles back, it might extend out. If you're going to pluck, you're going to grab the testicles in your finger, and you're going to grasp the hair with your fingernail against your finger, and you're going to go against the grain. And you just need to make the testicles naked in this case. Okay. Once you've got the area clipped, you're going to focus on scrubbing. I'm going to bring our scrub right over here so that you guys can see. You're going to take 1 gauze at a time, set up your trash can off next to the table, because what you don't want to do is pick up your gauze, squeeze it back into the bowl. I know you're going to see it a lot, but what you're doing is taking any dirt off of your hands or gloves and putting it back into your scrub material. So you want to pick up your gauze, bring it over the trash can and squirt it into the trash can, into the sink, whatever you have available, just not into your container. You're going to take your gauze square, find the center where your incision is going to be, and you're going to start with that center, and you're going to go around in a cinnamon bun fashion. Now, when you get to the outer edge, you can see where I'm going to touch the longer hair. That is gone. Take that and throw it off to the side. Don't go back over your incision and what you've scrubbed. So rinse, squeeze, cinnamon bun. Start in the center and work your way out. Okay, this is a contact time issue, not the number of times you actually do a scrub. So squeeze, cinnamon bun, go around. If you have an extremely large animal, you might have to go squeeze, rinse, start in the center, work your way out, and then when you get to the next scrub, you're going to start with that outer edge and continue it on out. So it's going to depend what you have to work with. And you do your scrub, rinse, 3 times. Okay, if your patient is particularly dirty, then you're going to do a dirty scrub first until that comes clean, and then you're going to start your official scrubbing for your patient. The male dog, you're going to do something very similar, but remember you're going to have to scrub the testicles as well as around the penis. So usually what I'll do, the incision is going to be right in here. I'll start right in there and I'll go around this way and I'll go around up and over, and that one's done. Do my next scrub, I'm going to go, or rinse, I'm going to go center, go around, out, up and over. My next one, I'm going to go around that center, and I'm going to go around back behind the testicles and get those. But I'm not going to go, I'm going to go this way first, then I'm going to go this way and around this way and off that way, so that I don't bring any of the dirt or contamination from the testicles back over what I've scrubbed around the penis. And you want to consider this an area of contamination. So if you go up over this, anything from that point forward is going to contaminate your patient. So you're going to do your scrub, scrub, rinse, rinse, scrub, scrub, rinse, rinse. Okay, your cat testicles are going to be very similar. You're going to grasp those testicles in your fingers, and you're going to grab your scrub, and you're going to go around both of them. And remember, your rectum is going to be right here, the penis is going to be right here. So when you get to the outer edge, that's considered contaminated. You switch to the next one. So that was your scrub. Here's your rinse, your scrub, your rinse, your scrub, and your rinse. Okay, we've officially scrubbed, clipped and scrubbed all of our patients. The last part to your patient prep is to administer a block to them. So your dog or your cat spay and your dog spay, you're going to block along that incision. So you're going to start with a 25 gauge needle on your syringe. You're going to put it just underneath that surface of that skin. So if my incision's from here to here, I started right here and I extended my needle forward. So if I take it out and show you, that's where I'm going to start injecting my block underneath. So put it back underneath. I'm going to pull back to make sure that I don't have any blood, and I'm going to inject as I pull that needle out. Since this is a stuffed animal, I'm not actually injecting. So now see where I ended here? I want to re-poke right along that incision and bring it forward. So now my needle ends there. Pull back, inject as I'm pulling out. Same thing all the way through. Pull back, inject as I pull the needle out. And you're going to do that along the entire length of the incision. Your dog neuter is going to be very similar. Most dogs are a little flatter than our little stuffed animal guy here, so it might look a little bit awkward, but it's going to be the same concept. Your incision is going to be right here. You're going to put your needle in just underneath, pull back, and inject as you pull the needle out. Okay, that's going to block your incision. You're also going to want to do a testicular block, which means you're going to grasp the testicles in your hand. You're going to inject your block into the caudal aspect of the testicle, pull back, and inject. This one you don't have to pull out and inject as you're pulling out. Just inject in there. You're going to inject until the testicle feels taut. Okay, it typically comes up to about half of what you've got in your syringe, but don't count that as a steadfast always rule. You're going to wait until it's taut. Okay, now for your cat neuters. A lot of people don't block for cat neuters, but if you do, and it's still a good idea, you're going to want to do the same thing. Put it in the caudal aspect of the testicle, pull back, make sure you don't have any blood, and then inject until your testicle feels taut again. And then you're going to repeat to the other testicle. Now you've scrubbed, clipped, blocked your patient. The next thing you're going to wind up doing is moving your patient into surgery where you're actually going to do a sterile scrub. Since I'm not set up to actually do a live patient in a sterile scrub, I'm just going to talk about it a little bit. You're going to have another set of containers already prepared and sterilized. In this case for the school, they're 2 silver bowls. You're already going to have the gauze in it. They're going to be in a paper pouch. And you're going to put sterile gloves on, not exam gloves. So you transfer your patient in, set them up, hook them up to anesthesia, get the monitors ready. As soon as the anesthesia says you're good, you're going to don your sterile gloves, and you're going to go through the same process where you're using your scrub and your rinse, where you're going to do the cinnamon bun and then the rinse. Okay, once you're done with that, you can let the doctor know they're ready to start, and you can take off your gloves. And that's how you prep your patient for surgery.